Hi, everybody. Welcome again to our second week of our wellness series here in Mountainside. I'm Lucia Carinante. Today's topic is muscle. So let's begin with a couple of things that I wanted to talk about beforehand. One second. I thought I had the paper, so just bear with me. Okay, so before we talk about the science of this and the protein aspect, and hello there, hi. And sorry, somebody joined on our Zoom. And the science of this, or the exercise prescriptions that I'd like to talk about, I want to take just a moment to sort of reflect on aging. I was just talking about it a moment ago with somebody regarding sarcopenia, which is the loss of muscle, which starts around in your 30s. And they used to think that it was just because we got old. Now it's actually diagnosed, in 2016, it was diagnosed as a disease. So right now, since 2016, sarcopenia is diagnosed as a disease. So what does that mean? That means muscle is really important. So the more we have, the healthier we are. So it's sort of like a safety net for keeping yourself healthy. It helps with your metabolic health, which includes your glucose levels, your insulin levels, your blood pressure, your cholesterol, so many things. So what I want to talk about today is how do we keep our muscle strong and what can we do? So I'm going to explain a little bit about it first. One thing that muscle is it acts as an amino acid reservoir during illness or stress. So when muscle plays the role of that, it helps our immune system. So again, the more you have, the healthier you'll be. If you get sick, it will help you heal. Muscle mass is critical, again, for your immune system during surgeries, infection, helps with recovery. These are things that I guess people sort of don't realize. And again, I was just talking right before we started about the sedentary nature of our society, especially after the COVID pandemic. So many people work from home, younger people. The retirees, I guess, hopefully keep busy, but the younger people, it changed a lot. So you see a lot of obesity and sedentary lifestyle in that age group. So again, muscle loss will reduce a lot of things that are detrimental to our health. So we want to make sure we're working out. My recommendation is to do maybe at least 4 days a week. I'd like more, but we'll see, how people progress. Okay, so muscle is also considered the organ of longevity. And what does that mean? So skeletal muscle is a primary regulator of metabolic health. I talked about metabolic health, so we understand what that is. And it plays a role in how our body handles energy. So it's important because especially when you're eating, and if you have a meal comprised of all the macronutrients, we want to make sure that that the metabolism works effectively, and the macronutrients and the energy from it, the sugars and everything from the meal goes into our cells. So muscle helps stabilize our blood sugar and reduces metabolic stress. So keep that in mind. One tip I would give, that if you guys would like to hear, when you have a meal, let's just say at the end of your meal you want to have something sweet, which a lot of people do. I would say maybe reduce that to once a week. But if you do, say you want a little cookie or something, eat it with the meal and go for a 20-minute walk. And that's going to help reduce the sugar spike. So part of keeping our bodies in good health is keeping our blood sugar stable, and muscle also helps that, okay? So let's talk about health span versus lifespan. So lifespan is how long we live. Health span is the years lived with strength, cognition, and independence, which I know we all want. So most chronic disease reflects the loss of metabolic flexibility. So again, I'm going to keep reiterating, muscle is the organ of longevity. So it helps your metabolism and your metabolic flexibility. In our world, modern medicine excels at extending lifespan, but it doesn't help preserve function in some cases. So medicine can help us live longer, but often without preserving our strength and mobility. So there's lots of people, that have to take medicine, and we have, wonderful doctors and everything that helps us live longer. But we also want our especially as we age, we want to manage the chronic disease. And again, go back to muscle. Muscle is one of those tissues that keeps repairing and keeps growing as we age. There's no limit. I just met a gentleman who's 78 years old. We have this weight room for the seniors. There's never anybody here. So I encourage everybody to get up and go work out and learn about lifting weights. Okay, let's move on. Why is muscle different? I might have mentioned this, so bear with me. So living longer doesn't necessarily mean living well. So we want to talk about how muscle, the largest insulin-sensitive tissue in the body, helps us to live healthfully, because it's the primary site for glucose disposal. So what does that mean? So when we eat, and our bodies make glucose through our fuel, if it doesn't get into the muscle, it gets into the bloodstream. So what is that? That's insulin being produced, being secreted from the pancreas. When we have more muscle and we eat, we have more of a chance for that glucose disposal to be dumped, and we don't have it laying around our bloodstreams, therefore lowering our sugar spike. And it is a great regulator for that in terms of our metabolic health. So the loss of muscle will drive your fat gain. You'll gain weight and you'll become insulin resistant versus insulin sensitivity. And it's so easy to fix this. If anybody has type 2 diabetes, it's not hard. You have to look at your meals. You have to prioritize protein. Carbohydrates are okay, but you have to understand good carbohydrates versus not so good. That I'm going to talk at another time, but it kind of plays into the muscle, so that's why I want to bring it up. Okay, so I think I said this earlier, I'm not sure, I might have said it to one of the gentlemen here, that muscle is an endocrine organ. It's part of the endocrine system. So skeletal muscle release signaling molecules called myokines. What are that? What are those? Our myokines influence brain, they're molecules. They influence brain health, immune system, and inflammation. So exercise-induced myokines will support longevity signaling. It's amazing, right? In my opinion, it's amazing. So we want muscle to be prioritized, and it rarely is, especially in aging discussions. Because I do work with a lot of older people who are on lots of different medications, and they get worried about lifting too heavy or working out too much. And it's just really not true. And also, it helps our skeletal system. So as we age, especially women, we lose estrogen, men too, but that signals the bones to start weakening. So what happens? We get osteoporosis. So building muscle helps strengthen the skeletal system. So keep that in mind. So exercise is really important. Some low impact jumping helps build bone. So if you have a little tiny trampoline where you can hold on, it's really good to do. People get afraid, but don't be afraid. So another thing about muscle as the endocrine organ, which is important, is it's a protective tissue, and it protects your health and function more than your appearance. So inside your body more than outside. We all want to look good, but we want to know what it's doing inside. It's protective against disease. It's protective against osteoporosis. It's protective against your blood sugar. So think of it like that. It's part of the endocrine system. It's an endocrine organ. And we have a lot of it, right? Okay, so again, I'm sort of crossing over, so pardon me. If you have any questions, you can bump in. Muscle and blood sugar control. As I said before, the more muscle, the greater glucose uptake, which means we keep our blood sugar stable. It improves our insulin sensitivity without medication. I was speaking to somebody today who's type 2 diabetic. He has good days and bad days. And so I understand we all want, food is celebratory and we want to have a treat here and there, but you can't have good days and bad days. You have to have more good days. When you're diagnosed with something so serious as type 2 diabetes, we want to try to mitigate that, get rid of that. So if you have one bad day, it's okay. When your body composition changes and you have a good amount of muscle mass, skeletal muscle, your body can handle something that normally when you're not in a good skeletal muscle ratio, you're not going to be able to handle maybe a bad meal or a treat or something. Your body, you will be insulin resistant. And then that means you keep secreting insulin. It's not healthy. Okay, so just keep that in mind. Any questions, pop in. Okay, next topic. Muscle as a protein reserve. So what does that mean? We talked about this. The amino acid reservoir during illness, recovery after surgery. Keep that in mind. I know I talked about it, but I just want to reiterate that, especially with injuries. So people that have maybe some muscular injuries or bones or illness, muscle is going to help you heal faster. So I have stenosis in my low back. That's just a narrowing of the spine. And one of the discs went out of place and I was hospitalized. I was in really bad shape. But within a week of my scans, there was an immediate change in the positioning of it. And the doctor said, because you have a good amount of muscle, your body heals faster. I was really surprised to hear him say that because I don't hear doctors talking about it as much as I'd like to. But I'm not a doctor, but I try to get as much information to pass on to you guys. This is all sound information. One of the researchers is Dr. Gabrielle Lyon. If you'd like to look her up, she wrote a great book called Forever Strong, and it really describes how you can move into your life healthfully. Okay, so sarcopenia, I talked about that. Remember, it begins in your 30s. So if you're 40, 50, 60, 70, it's already started. So you have to remember, if some young people end up watching this, keep your strength training routine and workouts consistent, okay? It's all about consistency. You don't have to do every day an amazing workout, a long workout, the best workout, but if you're consistent and you get yourself to the gym or your home gym or whatever, your body is going to respond to that. Consistency is most important. But what I want to say about the sarcopenia, which I did mention, is now it's diagnosed by the CDC as a disease. It wasn't before. It was thought to be a result of aging. But now we know that it's not just about aging, it's about being sedentary and not using resistance training as part of our life. Look at it like that. It should be part of your life. Okay, so what happens with sarcopenia when it spirals out of control? the muscle loss, that's sarcopenia, lowers our metabolic rate. So what happens with our metabolic health? A lot of things. So our fasting blood glucose can hike up. Our triglycerides can hike up. Our HDL cholesterol, in turn, can go higher. Our blood pressure, lower. Our blood pressure higher. Waist circumference more than we want. So putting that all into perspective, it's all a positive, right? And you'll feel better, you'll look better, you'll be happy. The other thing is fat gain worsens when there's insulin resistance. So if you think, why am I gaining this weight? I'm not, I'm eating okay. Maybe your meals are, decent. Maybe you're not exercising. Maybe you're exercising once a week. I don't mean cardio. That's a whole different thing. Cardio is for your heart and lungs, very important. I'm specifically talking about weight training. You have to think about that and realize you might not be losing weight because you don't have enough muscle. Your muscle is going to help burn fat more effectively. So insulin resistance accelerates muscle loss. So again, it's like a catch-22, right? So all you have to do is lift weights, eat healthy. If you have that one bad day or you're at a party or celebratory and you want to have some sugar or maybe processed food, which I don't, encourage, but there's times where people are busy. Your body's going to react better to it if you have a good foundation, meaning a good amount of muscle mass. So that's a really positive thing. Okay, this is really important. Protein needs change with our age. So the government, RDA, it recommends a specific amount of protein. I'm so sorry, I can't remember, but it's too low. So, and I'll get that information as we go along. I just can't remember it right now. But the recommended amount for muscle growth and muscle mass and keeping that on our skeletal system, skeletal muscle, is minimally 1 gram of protein per pound of body weight. So let's say you weigh, for example, 100 pounds, which is not, but you would want to eat 100 grams of protein while you're working out. Your body needs that much protein to repair the muscle tissue, because when we work out with weights, we lift weights, we're damaging the muscle, we're damaging the tissue, it's stress on the body. Protein, the amino acids, all help repair that muscle and grow it. So it might be hard at first because this society, in our world, in our country at least, eat approximately 30 grams of protein a day, right? That's maybe 4 to 6 ounces of chicken. That's it for the day. And about 300 grams of carbohydrates. That's the average. So you could see the disparity there. And really, we probably need a fraction of those carbohydrates. The other thing to know about protein and carbs, carbohydrates are not an essential macronutrient. They're delicious. They're good for you. There's positives. If you're a bodybuilder, you need that to, to continue with the longevity workout when you're lifting so heavy. A swimmer, people that are really serious athletes. But our bodies will make carbohydrates from the protein. So for the average person who's just going to the gym, living a normal life, you want to try to prioritize the protein. If you start a weight training program, you want to start with at least 30 grams of protein per meal. Don't be afraid of your carbohydrates. Keep them healthy. Fruits, vegetables. And the 300 grams that the average person is eating is most likely fast food, the palatable processed foods that are so delicious for some people. And they're easy to eat because they're so good. Protein, it's a little bit harder to eat a lot of protein. So it's something that you have to actually pay attention to. Higher doses of protein are needed to stimulate muscle protein synthesis, which is the the act of building the muscle, okay? Any questions? Good. So now we're going to talk about protein distribution, and that's how each meal, how it's important, because muscle protein synthesis is triggered per meal. So the most important thing is the first meal of the day, you want to have protein. You want to start your day with protein. Skipping protein earlier in the day reduces total synthesis, the muscle protein. So we don't want that. We want to start the day with protein. Most people are used to cereal or bagels or toast, or some people have like sweet things like croissants and things like that. You want to try to eliminate that out of your diet, specifically in the morning. And you want to start your day with eggs or steak or even chicken or ground beef. I know that sounds crazy, but it is a doable thing. And I think that you would be surprised at how much better you feel, how your cravings will go down. When we are satisfied, protein is one of those things that satisfies us. Our cravings start to minimize. It takes a little while, maybe a couple weeks, for some a little less, for some a little more, but you'll start to feel better. You'll start to stop looking for snacks. Speaking of snacks, let me throw this in here. The more times a day you eat, the more you're secreting insulin. We don't want that, okay? So just remember that. You want to try to have 2 to 3 meals. Fasting is a positive thing for us too, because it turns on autophagy is a process where we clean out bad cells and bring in healthy cells. So I'm tying it into this because I'm talking about food. It might be a different topic, but if you can try fasting from your dinner, maybe 7 o'clock to maybe 11, 12, that's a great time to start your first meal and begin it with protein. Leucine is found in protein foods. It's an amino acid, and it's a key amino acid that signals muscle protein synthesis. So just a little bit of science there. Okay, so we're gonna move on to strength training as medicine. I talked again a little bit about it, not to be repetitive, but the mechanical tension is the primary driver of muscle adaptation. So we want time under tension when lifting weights. Why? Because it builds our muscle, it improves insulin sensitivity, independent of weight loss, but it's still important. It enhances bone density and joint integrity. So it helps keep our joints healthy, which reduces risks of falls and fractures. Very important as we get older. I was just talking about my husband, who is he's 62, not that old, right? Middle-aged, I would say, and he fell, just a simple fall, and tore his quad tendon off the knee. So, we never know when things like this are gonna happen, and he's in shape and he's fit and all of that, but as we get older, it becomes a little difficult with balance. So strength training as medicine, this is the prescription the doctor should give. Go strength train. That's gonna help your body continue to stay strong, balanced, and healthy. And it's what I do, so I'm really passionate about that part of it. Muscle loss, as I said, starts in our 30s, and it's accelerated by inactivity. And as I said, I'm seeing so many people being sedentary and under-eating protein. So the lack of movement and the lack of protein speed up the muscle loss. So this isn't benign. Increases of falls and fracture risk is really serious, and less muscle means less stability. So it's a strong predictor of being disabled, and we really don't want that. So I'm gonna switch gears a little bit and move over to cardiovascular. Why cardiovascular exercise alone is not enough. So if you look at what cardio, right, our cardiovascular system, people, I've worked in gyms for a long time, people get to the gym, they run on the Stairmaster, they run on the treadmill, run to it. Like they want to get in an hour of cardio. Great for your heart and lungs. But it's never going to help you lose weight. It's never going to help you build muscle. So I want people to understand how very important it is for muscle to be separate, muscle weight training to be separate. Do your cardio, but just don't be fooled thinking that that's enough. It will help your heart and lungs, absolutely, and train and keep it in shape and give you good endurance. So when you could walk longer, you could climb stairs, you could, do all the things you want to do, but it's not adequately going to preserve muscle mass. So, and excess endurance, excess cardio without training, without weight training, can accelerate some muscle loss. So remember to find the balance for the cardio and the strength training. Strength training it's non-negotiable, in my opinion. Okay, so now we're going to talk about muscle and brain health. So the muscle, the more muscle we have in our overall body is going to help the brain. It's going to help the myokines that we talked about before, that induced from exercise cross the blood-brain barrier. It gives us better mood. It helps neuroplasticity. Neuroplasticity is the ability for our neurons to grow and change. Once they thought brain cells, once they were dead, they were dead. That's not true. We can change. We can change the way we think. We could change the way we move. We could change the way we behave. So muscle is very, very well connected to brain health. In saying that, and I always think about COVID and what it did for some of the younger people in our schools and stuff, and how depression and anxiety became like out of control, and how therapists and psychiatrists became so in need, right? And how this young generation, there's so many people with anxiety, but when you lift weights and when you have strong muscles, your depression is lowered, your anxiety is lowered. Somebody said, if you feel anxious, go for a walk, go to the gym. It immediately calms it down, and it helps with dopamine. It helps the hormones that help your brain feel good increase. So very important. Additionally, it's linked to reduced Alzheimer's, dementia, and Alzheimer's. So I think that's one of the most important things that we can think about today, with how scary that can be to have that as part of our life with our family. So I just want to point that out, that the brain is really affected, which I don't think a lot of people really know. I think that it's probably overlooked. Your brain, muscles help your brain, yes. Okay. Where are we? Any questions? No questions. Okay. All right, next. This is just a little information, I guess, and I thought it was interesting, how muscle equals independence insurance. So what does that mean? That means we want to get to, our golden years and not be dependent, not have to have somebody take care of us. Try to push that out as long as possible, hopefully never have to. Because why does muscle give us independence insurance? It preserves balance. It helps with mobility. It helps with coordination. It delays loss of independence and frailty. So it's a strong predictor of quality of life when you're strong and agile and flexible and you can move. I know this might sound crazy, but just squatting. If there was one exercise I would say for everybody to start doing is squatting. What do we do? What is that motion? That's sitting on a chair, that's sitting on a toilet, that's getting out of bed. So imagine if you couldn't do that. So think about that as a way to kind of motivate you. If you're somebody who isn't on an exercise routine right now or any kind of workout program, just think about that in general. Also push-ups. Think about how you lift things over your head. These are really important because it gives us the freedom as we age. Muscle is freedom. Really something to focus on. Okay, let's go back. Why this is not emphasized in medicine, I don't know. I wish I did. But it's rarely measured clinically, muscle mass. So there's some tests that we do as trainers called BMI, body mass index. I'm not a fan of that because it goes by your height and weight. So we could have like wrestlers who are not that tall but really muscular, and they would be considered obese just because of the ratio between the height and the weight. So I want to just like push that aside. I wish, it wasn't one of the factors that they use, or the measurements, I should say, the tools that they use to measure it. But healthcare prioritizes disease treatment over prevention. I wish that weren't true. I'm not a doctor. I really don't know how to change that. But what I can change is just giving you the information and to help you prioritize exercise and nutrition. In medical school, this is known. I have friends that are doctors. There's really a minimal amount of any nutrition training or any exercise training. I think that's changing. I hope that's changing. I heard that that's changing. But let's hope. So patients are rarely told that muscle loss is optional. They're rarely informed how important muscle gains are and how it can help them in preventing whatever is going on. Say it is type 2 diabetes, say it is cancer, say it is kidney issues. They're rarely told, hey, go to the gym, here's your script. Go work out 4 days a week for 40 minutes and see how you feel in a month, come back. I wish that was the way it was, but it's not. But I want you to know that that's something that can really help you. Okay, going on. I don't want to repeat myself, so I want to just make sure I got everything here. Just give me a second. I got to look up one thing here. Okay, might have been. Let's see. Okay, so let's go back to, I want to go back to the protein needs that change with age. I want to emphasize for older adults that we need more protein because we don't metabolize it the same. So when you're young, your body works differently. You're running on hormones. There's so many good things going on. So as we age, actually, what the RDA gives you, you need double the amount over, I think, the age of 50. I'll double check that. Women are totally under consuming protein. Just like a funny story, I'll tell you, I have a lot of friends and they're always asking me advice. So I made lunch for everybody, and I had chicken, I had salad, I had some bread, and everybody took their bread and their salad and vegetables and like a little tiny piece of chicken. So I took out a scale and I made everybody weigh the chicken to see how much protein, and I wrote it down for them, and I explained to them how much they actually need per meal, and it was shocking to them. So it helped them identify what they're eating. So I bring this up because sometimes, as I talked about before, how the protein distribution really matters in terms of your meals. You might invest in a small little food scale so you can start to weigh out how much protein you're actually eating. You'd be shocked and you'd be really surprised. And I think it's a good tool to have because it brings awareness. And that's really the important thing here. It's not about comparisons. It's not about shaming or feeling bad or, oh my gosh, I'm not doing it right. It's just about awareness and education. So what I would say is just get a little scale. And when you cook a piece of chicken or fish or steak or whatever protein you're having, put it on the scale, weigh it out, Google how much that is in terms of the grams for the chicken or the protein, whatever protein source you're having, and you'll be really surprised at how much more protein you're able to eat. And again, I said before, it'll help you distribution of your macronutrients in the meal. So you might not want all the carbohydrates. Again, carbohydrates are fine, just be careful what kind you're eating. So let's talk about how often it is enough for resistance training. So as I said, minimally, I would say, I'm being really like sort of lenient with this by saying 2 days. I really shouldn't even say that. I would say minimally 3 days, 3 days minimally. Ideally, 5 days is ideal. What you want to learn about building muscle is something called progressive overload. And why does that matter? Because muscle needs consistent increases to challenge it to build. So let's just say, for example, you start a little program and you are doing 12 to 15 repetitions for a specific weight. That's a lot of repetitions. So what I would do is, if your form is good and maybe you're working with a trainer or even a video or something, educate yourself so you can learn form, proper form. You want to get between 8 and 10 reps with a specific weight. So let's just use the squat, for example. Let's say you hold 2 dumbbells, and I'm just going to be arbitrary, say they're 20 pounds each, and you do 15 reps. That means it's too light. So what you want to do is you want to get to the point where your weight can dictate that you get 8 to 10 reps. Once you get 8 to 10 reps, then you stay with that for a few weeks and then go up after a few weeks to a higher weight, and you're going to continuously, progressively overload the muscle. That's what progressive overload means. So I want you to learn how to build muscle in order to create a better health environment for your body, your skeletal muscle. You hear that? Okay, so I'll just keep going. Sorry about that. Okay, so strength slows physical decline, so that's why we want to build that muscle. It's, as I said, a predictor of quality of life. And that's really very important. If anybody has any questions about how to do this, you can email me. I'm sure Alana will give you my email. But just to keep it as simple as possible, progressive overload, you can Google it, learn about it, and it'll, if you look it up, it'll teach you how to manage reps with weight so that you're always increasing the weight to challenge your muscles, to rebuild, repair, and grow. Very important. It's never too late to start, no matter what your age is. I said the gentleman that just walked by me is 78 years old, and he's in there. He's still in there. It's 45 minutes, so he's doing something really good for his body. Training works at any age. Building muscle works at any age. And as I said before, consistency beats intensity. So don't feel like you have to go all out, throw everything, like you're going to exhaust yourself, like no pain, no gain. I don't believe in that. It's that muscle just needs increasing challenge. So building the muscle, supporting the muscle with protein. Weights are building, protein is supporting that growth. So you need to understand both of those factors that are at hand here. Also, muscle strongly influences your daily life, right? It, again, I said, it preserves your autonomy. It preserves your independence and your freedom. And we talked about why, healthcare doesn't prioritize that. I wish it did. But again, it's critical. It's muscle loss is not inevitable. It's absolutely not inevitable. A lot of people like to say, oh, I'm getting older and this is what's happening and now this hurts and that hurts. But the more muscle that you can put on your body, you'll notice that your joints feel better, your mind feels better. Everything's just going to fall into a really positive place, in my opinion. So some of the key takeaways that we can just go over really quick is remembering that muscle is part of the endocrine system. It's the organ of longevity. It helps stave off disease. It helps you have freedom in your life, independence, strength, and here's the gentleman who just proved that. It's essential. It's not optional. It's not optional. You get up and you brush your teeth. You get up and you work out, right? There's my friend. Adequate protein, go eat your protein, is, have them now though, you just worked out. You got to feed your muscles.
I had them this morning.
No, you need them now after the muscles are ready to take them in. Have some more protein. Have something, anything. Sorry, I digress. Have a good one. Adequate protein intake, which I was just telling this gentleman, he just worked out. So within an hour of that workout, you want intake of protein because that's when the muscles start to repair. It's foundational. It's absolutely necessary within an hour. So he thought, oh, I ate this morning. He has to eat after the workout. An hour and a half, because it preserves the muscle. So preserving that muscle gives us independence, gives us freedom, gives us, life, and keeps you young. It keeps your whole body feels better. You look better. Mentally, you feel better. And I just think that it's, part of what everybody should be thinking about and talking about. And we get rid of this obesity epidemic in our society and hopefully live a long, happy life. So anybody have any questions about this? Tom, I know you're still there. Do you have any questions?
No, I want to find out. Can you hear me now?
Yes, I can hear you.
Okay. I wasn't here for the first session. What was that about?
Oh, the first session was about sleep. If you would like, I'll get your email from Alana and I could send you my hard copy so you can learn about the benefits of sleep and how we are, we're an undersleeping nation. People are on their computers and tablets and phones. So I'll absolutely send that to you.
Okay, great. Give me my email.
Give it to me, Tom. I think Alana gave it to me, but give it to me now anyway.
It's ShownTom
Okay.
at AOL.com.
Oh, easy. Okay, Tom. And you have no questions about today?
No, I don't. It's interesting. I actually would use plant-based proteins.
Okay. I understand that. That's good. Everybody has, what works for them, and as long as that's working for you, that's excellent.
Yeah, I went ahead and did the Dean Ornish program.
You did the what?
Dr. Dean Ornish.
Dr. Dean, yes. There's just amino acids missing from plant-based protein, so you want to maybe look for, excuse me?
Supplement with B12?
Well, no, not only that, but amino acids, essential amino acids. So you might want to find a supplement that can maybe put in a drink because plant-based proteins don't have the amino acids that animal protein has.
I've been taking the AG one every day.
Okay.
And then there's another supplement, Max, whatever it is.
Okay.
I'm supplementing that way.
Good. But look up amino acids. That's the building block of protein, muscle.
Mm-hmm.
Okay?
Okay, great.
All right. Thank you. Thank you, everybody. I hope you enjoyed it, and I'll see you next week.